Either. Never.
Good afternoon, everybody, and welcome to Relocate with Nat. My name's Nat Mayot. I hope you're having an incredible day. It has been a hot minute since I've done one of these videos, but this is a topic that I've been really want to get onto because it's one of the top questions people ask on social media when they decide to travel or to relocate, and is, can I have health insurance when I'm in the Dominican Republic? And I can say without a doubt, for sure, the answer is yes. I'm joined today by Norm Bates and his lovely wife, Ramona. They are located in Puerto Plata, but they actually service the whole country. So it doesn't matter where you are, they can be a help for you. So thank you very much for being with me. Bienvenidos. I must crack my Spanish out today. But a couple things, you guys have been doing this for quite a while. Tell me, I want to make sure we give props to Ramona. Ramona just won or earned a very distinguished honor, right? So tell us about that.
Yes. Can I speak for you? Well, for the last 2 years, she won the top sales award from Humano for the North Coast. So
wow,
that means it's very unbelievable. She started about 5-6 years ago, and now she's winning 2 years in a row the top award. So I'm very proud of her. She works very hard and she's very good at what she does.
And I think one of the things that I've been, attracted me to, not that way, Norm, but how we connect on social media was really that I find that you guys are really being of service to people. Like you are there to help people make sure that they're okay when they go into the hospital. So I guess my first, thing I'd love you to talk about is the importance of having health insurance when you're not just obviously in the DR anywhere, but about being here. How is that, should be a priority for people?
Okay, may I speak? Well, for example, in my case, about three years ago, I had COVID very badly. So we went at 12 o'clock at night to Santiago, and they wanted 300,000 cash pesos before we even got in the door. Thank heavens Maria had a good insurance, so we got in right away. But they want cash up front or a Visa credit card or something. So that's why it's important when you're sick, you have the card and you can get in right away to the top hospitals in the country.
That has to be. Now, I think you sent me a QR code, didn't you?
Yes. As well as for emergencies, being admitted right away. Yeah. It covers doctor's visits, a big portion of doctor's visits. You only pay maybe 1,000 pesos, 1,500 pesos. Lab tests mostly covered, but very expensive tests. You have to wait 6 months. But these are extremely expensive.
And we went through it here when we actually ran out of our travel insurance when my husband was hospitalized in the fall of 2021, and we luckily we only had to pay a deposit when I left the hospital. And we had to pay a deposit for the room. That's what we had to pay the deposit on. And then they gave us a bill, but they wouldn't take the IV out of his arm until the bill was paid. which I thought was I was so frustrated because I was like, can we just go? And they're like, oh, you have to pay the bill. But anyways, that's a whole other video. So what are some of the top things that people need to be aware of when they're getting their insurance here?
They have to be under 70 years old.
Under 70, okay.
There's no medical, but the other thing is that if you have a precondition, it's not covered. And normally, when you get admitted to a hospital, the doctor decides if you have a precondition or not. And if he says, no, you have one, then they don't cover it. So that's the only main important thing to remember.
For the woman have baby, wait 6 months.
Exactly. When the woman's pregnant, she has to fool around before she gets insurance, not after, to be covered.
Okay, you have to be insured after you're pregnant to go to the hospital?
Before,
Oh, before, yes.
yeah.
Awesome. Okay. So what are some of the areas that like you are expert, like one of the areas I know that you've been servicing are the veterans?
Yes,
You have a special
Yes.
plan for them, don't you?
yes, it can save them a lot of money. It's an exclusive plan that was developed in conjunction with the American Military Legion. And it covers veterans from the United States, Canada, all NATO allied forces, and about 40 countries. So they can
Wow.
all be eligible for this fantastic savings. So,
Okay.
but again, it's under 65 years old.
So, I mean, I, help clients sometimes move here when I'm helping them move. Is there any type of insurance for anybody that's over 70, or is this really not an option?
I'm not aware of anything locally for sure, but I think if you're from Canada, United States, you can buy private insurance to cover travel. But
To cover
locally,
travel.
we don't know, there's nothing, right?
No, only they have Senasa, but it's very bad.
Right. They have Sinasa, but you have to have a cedula, meaning
Okay.
a Dominican citizenship.
Mhm.
Okay. So unfortunately, folks, if you're over 70, you have to get private insurance from wherever you're coming from.
Yeah. Like Blue
Um,
Cross or something.
yeah. So I guess, sometimes you've been living here for a little while now.
Yes, for me, I've been here about 22 years,
22 years.
off and on, but
Yeah.
permanently the last 3 years, I guess. And then, but my wife and I, our oldest child now is 16 years old. So we have 3 children, 16 and Warren is that
13,
13
Samantha 6.
and 6. So we have 3 children now. And hopefully they'll start working in the insurance pretty soon.
That would be a great idea. So if folks are looking to connect with you, what is the best way for them to reach out to you so they can find out how they can get insured with you while they're staying here or either, if they're here permanently?
Yes. Maria?
You can say.
Okay, so Gmail is very good for us,
Oh, what's that?
or WhatsApp.
Okay, so we'll drop those in the description as well.
Yes, but particularly if it's an emergency, they call us day or night, doesn't matter what time, when they're in the hospital. And
Okay.
Maria, who of course speaks perfect Spanish and English, she can talk to the doctor, she can talk to the patient, and talk to the insurance company to make sure everything's okay.
Perfect.
In the night, we get calls late at night all the time.
Wow, that's an incredible service. And I have to say, that's something I noticed here. People do provide that. Even when my husband was sick, I actually reached out to the doctor that was treating him when we were home and on WhatsApp, and the doctor responded to me right away, which I thought was a miracle because in Canada, that doesn't happen.
Wow, I can't believe it. Wow.
I know.
Yeah.
I know. I was very grateful for that moment. So is there any other last words of wisdom when it comes to the insurance here that you would like to share with folks?
It's very easy to get. All we really need is their passport, a photo of their passport. And that's about it. There's no medical. So they just send us a photo of that. We can sign them up. And that's it. It's very easy.
And then
the
you guys work mostly with Humano. So are there like specific plans that you offer? Like there's 2 or 3 different ones.
Yeah. The Humano Max, we sell mostly to expats.
Okay.
That's about $75 US a month each. And Royal, which is a little cheaper, and then Superior. And then there's a really cheap one. But the cheap one, we only give to people when they go back to Canada for 6 months so they can save money. So we put them down, and when they come up, they go up again.
Okay.
So it saves them some money.
That's a good plan. I love it. So everybody, if you are looking to, you do not have health insurance yet, I highly recommend that you get in touch with Norm and Ramona to make sure that you get covered. It is a small price to pay if there is something that happens here in the DR. For the most part, you will get great care. I know that people have everybody has their own stories about healthcare here in the DR, but so far so good for us. I think having Ramona as a resource, if you need to, will be excellent. Whatever you choose to do, I hope you have an incredible day. Thank you both for being here with me. Muchas gracias. And I will see you in the next episode. Thanks so much, everybody. Bye for now.